managing medication and insulin at home. And we have a very well known doctor with us, Dr. Arun Kumar. Doctor, can you please introduce yourself with the audience so that they can know you a little much better?
Hello, I am Dr. Arun Kumar from Neyveli. I am currently practicing at a village near Neyveli, and I my specialty is podiatry. I take care of diabetic foot care, and I have seen diabetes cases also over my clinic, and most of my practice and patients will be from rural area.
Right, doctor. Thank you so much for the introduction, and you're doing really good for while you're practicing your medicine with rural people. So it's a very noble thing. Now, before we really take up questions along the line of the topic, I would want to ask some very generic questions around diabetes. So, shall we start?
Yeah, yeah.
Okay. So, sir, to start with, what are the common symptoms of diabetes, and when should a person seek a medical attention if they're experiencing them?
Mostly, if in the patient, most of the patients in diabetes does not have symptoms. They are most probably they will be asymptomatic unless there is a complication. Only they may develop symptom, and the common symptoms which we see through our practice are polyuria, polyphagia, and polydipsia. The three common symptom in the diabetes. And before getting the symptom, the random screening of the patients only we can diagnose the patient. We have done nearly 18 medical camps last year, and we have diagnosed more than 300 patients in the medical camp. They does not have any symptom. They are a daily wage like the thing. The patient most of the time diabetes is asymptomatic, and the patient must seek medical attention when they have these symptoms such as giddiness or sudden weight loss, burning maturation, and the polyuria during nocturia. And sometimes the patient with the risk factors such as the parents are diabetic or family risk of diabetes and obese patient, and in case the females who has been on a gestational diabetes in previous, the high risk patients should screen for diabetes, and if there is a high blood sugar level, they should definitely seek medical attention.
Right, doctor. So, just like you mentioned, that usually diabetes is asymptomatic until unless we have a complication presenting in our body. So, can you tell us a little bit about the diabetes complications?
Yeah, the when we go to diabetes complication, we will categorize it as micro and macrovascular, but most probably I will categorize this as chronic and acute conditions. The things which we are going to have for long term will be the chronic thing, and acute such as hypoglycemia and hypoglycemic coma, and hyperglycemia symptoms such as DKA and hyperosmolar coma, and the chronic conditions such as kidney failure, CKD, and neuropathy, the burning sensation of food, and the loss of complete peripheral neuropathy. And there are other conditions as CAD heart, it affects the heart also. And over the long term, the patient may have autonomic neuropathy also, which may lead to silent heart attack, which we are having recently. Many we have seen through the cases of silent heart attack around the all over the world. And India is being the diabetic capital. We have to screen the patients for the complication also. Previously we used to do only sugar checkup and we'll give only medicine for sugar, but now most of the patients at the early stage when they are diagnosing, they have a kidney injury and UTA also they may have. So we have to screen for CKD at least yearly once, and have to screen for retinopathy also in diabetic patient in at the diagnosis, and at least 3 years once in the patient for long term. And we have to counsel the patient regarding the proper food care also. Now the recently diabetic food has become a chronic condition around most of the patient. We see a case with chronic diabetic food he might have for 2 or 3 years also. Now patients are having walking with the ulcer in the foot, so we have to
Okay.
educate the patient that about the proper food care also. And I consider diabetic food is both acute and chronic condition over the diabetic population.
Right, doctor. So, doctor, is it possible for us to manage these complications naturally or through some lifestyle modifications?
Yeah, definitely. The when we goes to diabetic treatment, it does not only in medicine. The treatment of diabetes has four pillars. I used to say wherever I go, I will say there are four pillars in diabetes treatment. The medication is a pillar. But lifestyle modification has two things such as physical activity and diet. That both is a treatment. It does not mean it's just a awareness or anything. uh, diet should be followed, and a regular physical activity, which is both the is considered as treatment. So without lifestyle modification there is no use in taking only medicine. So the person who has diagnosed for diabetic, or even everybody has to change their lifestyle. Now recently the most incidence of diabetes is due to lifestyle, the second sedentary lifestyle, and the lack of physical work, and the carbohydrate increased intake of carbohydrates leads to now more incidence of diabetes. Then the fourth pillar is diabetes education, that we have to do by ourselves. But the lifestyle modification, without lifestyle modification, definitely every patient will land up in complication, because the rate of incidence increase in insulin resistance is being on growing. So if he doesn't have any food diabetic kind of food control and a physical activity, it will definitely leads an increase in insulin resistance, and patient definitely land up in complication. So lifestyle modification is a part of a treatment. It is the treatment. With
Right,
medicine
doctor.
alone is not treatment.
Right, doctor. So you're trying to say that a balanced approach between medications, also insulin and lifestyle modifications is the key, right?
Yeah.
So talking about management of insulin medication for people who are trying to manage their system at home, what are the key guidelines according to you? So like some points from your side that they should keep in their mind to have like a balanced approach.
The the thing is, patient needs to have diabetes education, why they
Right,
are taking the medicine, and what is the use in taking the medicine. They have to know that if I take the medicine only, he will not land up in complications. So without patient knowing, you may think I am asymptomatic, I doesn't have any symptoms, why should I take medicine? So when it comes to home, the patient's attenders and the family members needs to be guided in that. And when we have treatment is OHA and oral tablets and insulin, and
right,
that most probably will have a morning and night only, before and after. Everything we have to explain to the patient, and patient must have something like, now recently many boxes are available, before food, after food, like that
right,
available, so we can keep that and take medicine. And when we go to insulin, it's better, always the insulin should be stored in cool temperature, has to be kept on fridge door, or the patient can keep it somewhere. Now we can even use mud pot also. We can have some sand, and we have to maintain the cool temperature. And before taking the insulin, the patient can keep it outside, or just rub it in the hand for a few minutes and take the insulin. And the rotation of insulin must be thought, because the not every patients can go to nearby hospital and get insulin
right,
injected. So they have to learn about the rotation of insulin, and we have to teach the patient which insulin should be taken, because now there are 100 units insulins also available in the vial. We are getting now 100 unit insulin bottles also. So patients should be taught which is 100 unit insulin and which color syringe, because most probably everyone might see only the red color syringe we will be using. Now the 100 unit insulin bottle has a orange color cap syringe. So we have to teach the patient about the insulin syringe also. They have to maintain separate pack for a 100 unit and 40 unit insulin. And the patient is well educated, and if affordable, not about education, if the patient is affordable, it's better to use insulin pens, because the patient, even with the visual problem, patients can titrate their insulin with it. And in home maintaining insulin, the insulin and OHA, patient definitely should do a self blood glucose level monitoring, so they can alter the doses. Or sometimes the patient may forget and take and go the insulin in their bag and expose it to heat temperature, and the potency of the insulin may lose. So the patient, if they're checking it on regular basis their blood sugar, they may know there is some problem, the sugar level is rising, and he can change the insulin or get a consultation from the doctor.
right, doctor. So, doctor, it's not always possible for us to be vigilant about the medicines that we are taking, right? Like on the right time, at the just before the meal and after the meal. We somehow miss one or two dose. So, for people who have somehow missed, like accidentally miss a dose, so what are your guidelines for such people? What should they be doing?
Actually, I used to tell my patient, if it is not possible to do it 24/7. Yeah, sometimes we may go out
Right,
and we may go even to function or long travel. We may, some due to some obstruction, we may not come back. So I will ask my patient to carry their medicine. If not possible, I will ask them as soon as come and take the dose. If they are on insulin, they have taken the
Okay.
food outside, they can come and take the dose. It doesn't make any difference. But the thing is, the patient should not take double dose. If I missed my morning dose of insulin, I have to take my afternoon 5 units and morning 5 units, should not take as 10 unit. It is not advisable. So the thing is, if the patient is having a proper diet and exercise, along with medication, if they miss a single dose, it does not make a complication in single day. But you have to take the next dose
Right.
without missing. Some patient used to think I missed one dose, let me take 3 4 days rest for like gym. One day I missed, I will go after next week. Like that, some patients even skip their medicine for a few days. That should be avoided. If he's
Right.
skipping missing a dose, he can take in the next dose, but does not add up the both dose.
Right, doctor. So, doctor, are there any potential interaction between the different medications or supplements that people must be aware
Yeah,
about?
the thing is, most probably with our population, rural population, and all over, the alcohol plays a vital role. Majority will take alcohol with medicine. Some may not take medicines and only drink alcohol and leave. So alcohol plays a role, and it leads to hypoglycemia. And some in our village side, they used to take some natural remedies also, like avarambul, other thing. That thing may leads to hypoglycemia. And in the patients who are on sulfonylureas along with insulin may end up in hypoglycemia. And most probably the drugs which we cause is more often sulfonylureas along with insulin.
Right, right, doctor. So, doctor, these are all the questions that I have from my side regarding this topic, and you have shared such valuable insights for the audience as well. I hope they are keeping themselves, like they're writing all it down. But before we really conclude the session, do you have anything particular for the audience regarding the topic?
The thing is that diabetes education that's I used to do, because we are doing mass campaign for patients around our village and our district, for in rural people especially, diabetes education, because the people around me does not know why we have to take medicine. Most probably they will say,
Right,
there is I am working hard, doesn't I don't need to take diabetes medicine, and they only will land up in complication. So by giving education, at least the thing is, one patient will spoil 10%. He will go and tell, I didn't take medicine, I am healthy. Then other 10% will not take medicine. So my only obligation is educate the people. I am even not non-doctors. Now many of my patients, colleagues started to, my friends also started to educate their neighbors, everyone. So by mass education
wonderful.
only we can prevent some complications. And managing
Right, doctor, you're
patient
saying
requires education to take medicine. Unless you will, so I have seen a patient who comes to me and asks, I have a blood sugar of 300, give me 2 days of tablet to control my sugar. I told, it is not possible. Yeah, you have to take for long term. He told, I used to take like this for last 2 years. He will go to some medical and self prescribe himself. He'll see the Google, give me these two tablets, 5 days like that, and he will say. So we have to educate such patients, and everybody has the role, because today it is going to be a biggest disaster for everyone around the world.
right, doctor. You mentioned a very, very important point that diabetes education is very important for its management. And I hope that people are listening to him, like listening to you, that it's very important and they are keeping note of this. So thank you so much again for joining us. It's really was a pleasure for us to have you on board. And I hope that audience find this helpful. Thank you so much, doctor, again for
Thank,
joining us. I hope you have a
thank
great day. Thank you, sir.